Let's talk about NSAIDs again. Hello and welcome to this edition of Urgent Bites, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today we're going to have another look at non-steroidal anti-inflammatory drugs. Now, we've talked about NSAIDs in relation to fracture healing on a previous Urgent Bite and in episode 2. Despite some animal studies suggesting delayed fracture union with NSAID use, the current reviews of human studies found no evidence of delayed union. But in urgent care, we also use NSAIDs in the treatment of soft tissue injuries. So do they impact on the healing of soft tissue? So I asked Dr. Kevin Bell, a Hamilton-based sports physician, his thoughts on using NSAIDs for acute soft tissue injury.
In terms of the use of non-steroidal anti-inflammatories with acute soft tissue injuries, whether they be ligament sprains or muscle tears, I try and avoid the use of them in the first week. There's been quite a lot of research come out of the University of Pittsburgh with Johnny Huard, among others, that have shown that in the acute phase that anti-inflammatories increase bleeding and result in reduced healing quality and increased healing time of both soft tissues and bones. So the outcomes for patient in the medium and long term are actually worsened by the use of NSAIDs. I guess, sure, in the acute setting, they might be helpful from a pain point of view, but not from a healing point of view. So I would discourage you using NSAIDs in the first week for an acute soft tissue injury. If people need painkillers, they can take paracetamol, codeine or tramadol, whatever your analgesic of choice is.
Now, I've attached an article in the show notes from the journal Physical Therapy from 2017. They reviewed the literature regarding NSAID use in muscle injuries, and at the end, they proposed a concept map. The article is worth reading, and the resulting concept map shows that they conclude that in acute inflammation from muscle injuries, NSAIDs are not advised. Now, we want these Urgent Bites to stimulate debate amongst the urgent care community as we all strive to practice the best evidence-based medicine we can. So do please let us know your feelings, experiences and opinions relating to NSAID use in soft tissue injuries. When do you use them? And when do you avoid them? What guidelines or evidence do you use to determine your choices? Let us know via podcast@rnzcuc.org.nz or pop over to our Facebook page and comment under this Urgent Bite there. We will factor this feedback into a future podcast discussion on this topic. My thanks again to Dr. Kevin Bell for his input this week. We will hear more from Kevin next week in episode 3. As always, you can expect an Urgent Bite each Friday leading up to our main podcast on the last Friday of the month. Please make sure you've subscribed to the podcast feed if you're using a podcast app, and do please share the podcast with your medical colleagues via social media. I look forward to seeing you all again next time, but for now, thanks for listening.